We just talked about working group insurance coverage and how that works with Medicare. We're now going to discuss retired employer group insurance coverage and how this works with Medicare. See, retired employer group health insurance coverage is when an individual and or their spouse is either retired or no longer working for that company, but they still will be offered the ability to continue with that employer's group health insurance coverage. Since the individual and or their spouse is no longer working, they will be required to enroll in both Medicare Part A and B when they turn 65 in order to avoid any penalties in the future. It's really important to understand that this individual will not be granted a special enrollment period SEP since they and or their spouse are no longer working for that company, and this type of coverage will not be considered credible coverage by Medicare. A lot of individuals we've seen here at Healthcare Solutions Direct have made a big mistake right here. So if you have any questions about this, please give us a call. Most retired employer group coverage that's offered today, though, will be in the form of a group Medicare Advantage plan, which will require the individual to enroll into Medicare. See, retired employer group insurance coverage is typically provided to someone that works for a large company. Fortune 500 companies will many times offer their retired employees an option to continue with the company's insurance in the form of a group Medicare Advantage plan. A lot of individuals don't realize that they're getting into a group Medicare Advantage plan. They think that this is the supplement. There's another reason why it's important that the insurance agent find out what the individual did for a living during the discovery process. This will begin the process of possibly determining if the individual has worked for a large company and they can keep the company insurance after they retire. Companies like ExxonMobil and Verizon are really good examples of Fortune 500 companies that will provide their retirees with a continued group Medicare Advantage plan. This is important for the insurance agent to determine this early in the discovery process so they're being respectful of the other person's time. See, group Medicare Advantage plans will typically be offered as a PPO network and may offer additional benefits that are not offered to the general public. The retiree may be happy with the coverage that is being provided to them and may need to go through a third party. It's really important because a lot of retirees that are on a group insurance plan with a Fortune 500 company will have to go through a third party. See, in the past, many employers would allow the retiree to keep the group insurance as the secondary, with Medicare Part A and B being as the primary. Fewer companies now are still providing this as a benefit due to cost reasons. You see, it saves the employer a lot of money to let a Medicare Advantage company create a plan specifically tailored to that large company. The individual will still be responsible for the Part B premium, and now guess what? The employer allows a Medicare Advantage plan to manage the retired employee group coverage. This is a smart business move for the employer, and it gives its employees an option for their health care with some additional benefits maybe that they might not be able to get anywhere else. So, questions that a retiree should inquire about with the coverage. Here are some of the key questions that a retiree should consider about their retired employer group coverage before they decide whether this will be the best fit for their needs. Number one, are they happy with the plan? That's key. Number two, will Medicare Part A and B be the primary insurance? Remember, many retirees think that the Medicare Part A and B will be the primary insurance without fully understanding that the group health insurance plan is actually a Medicare Advantage group plan. Number three, do all the doctors accept the plan? Number four, do they know their maximum out-of-pocket? A lot of individuals don't know what the maximum out-of-pocket will be under their group Medicare Advantage plan. And then lastly, number five, do they need to consult with a third-party administrator about the insurance? So when it comes to consulting with a third party, most Fortune 500 or large companies will use a third-party administrator to help service their retirees. Some companies will give additional benefits to their retirees to go through a third party, and some will just use the third party to help the retiree navigate their options. There are many third-party administrators that companies will use to help either administer or help the retiree with their Medicare options. Companies like One Exchange or Via Benefits are very popular administrators. If an individual needs to consult with a third-party administrator, they should first talk to that third party before talking to an insurance agent. So let's talk about a conclusion right now of retiree group health insurance coverage. An individual that's turning 65 that's being offered retiree group health insurance must take their Medicare Part A and B and pay the standard monthly Part B premium of $148.50 in 2021 in order to avoid any penalties in the future. This individual will need to be enrolled in Medicare Part A and B during their 7-month initial enrollment period. This individual does not need the services of an insurance agent if they must go through a third-party administrator or they are happy with their insurance coverage. If the individual does not need to talk to a third-party administrator and they're not happy with the insurance coverage being offered, they should speak to an insurance agent to discuss whether a zero-premium Medicare Advantage plan or investing around $100 into a Medigap supplement plan would actually best fit their needs.